Hello everyone, I hope you all are fine. Today we are going to discuss about the one of the important topic of the sensory physiology, that is pain physiology. In that we will discuss about the pain pathway. To understand the pain pathway, first of all we have to understand how the pathway work. Pain is a sensation that is carried out from the peripheral part to a central part. That is peripheral nerves carried to the central nervous system. So it has the following components, that is nociceptors, spinal cord, thalamus and the sensory cortex. So first, the nociceptive stimulus stimulate the nociceptors. From nociceptors, first order neuron take that nociceptive stimulus in the form of nerve impulse action potential to the spinal cord with the help of the first order neuron. From first order neuron, it goes to the thalamus with the help of the second order neuron. Since thalamus is a sensory relay center, so sensory nerve fiber mainly passes through the thalamus, and from thalamus, third order neuron take that action potential impulse to the sensory cortex where it interprets. In pain pathway, we have to further understand these second order neurons have two types. The neurons which conducts fast pains are called as the neospinothalamic tract, and which conduct the slow pain are called the paleo-spinothalamic tract. So further, starting with pain pathway, we have to understand what is a nociceptive stimulus and what are nociceptors. Okay, so starting with nociceptive stimulus, also called as the noxious stimulus. The stimulus which causes pain are called as the nociceptive stimulus. And nociceptive stimulus is different for different tissues. Like skin, for skin, it is pricking, cutting, burning. They are the nociceptive stimulus for the skin. But for the blood vessels, piercing of the artery and vein by the needle, thrombotic, and the excessive pulsation of the artery. And for the nerves, it's the compression of the nerves. For GIT, it's the inflammation of the mucosa, distension or spasm of the smooth muscles. For the joints, it is inflammation of the synovial membrane. So nociceptive stimulus is different for different tissue. Nociceptive stimulus are of three types: mechanical, chemical, or thermal nociceptive stimulus. Thermal nociceptive stimulus may be hot and cold. Further, you have to understand that the temperature which are less than 5 degree, that cause pain. The temperature which are greater than 45 degree, that will cause pain. So these are the various nociceptive stimulus which causes pain. This is the first part of the pain pathway. When stimulus come, that will stimulate the nociceptors. Nociceptors, there is a conformational change. There is a formation of the action potential that will take the action potential to the sensory cortex for the various interpretation. Nociceptors are pain receptors, and pain receptors are not like cells, they are just the free nerves ending. Now you know that the mechanoreceptors are like cell, like Pacinians, corpuscle, raffinis, ending, Merkel cell. They are the cells, but pain receptors are just a free nerve ending. Free nerve ending of A delta fiber and C fiber. According to Erlanger-Grasser classification, there are three types of fiber: A fiber, B fiber, and C fiber. A and B are the myelinated and C is the unmyelinated fiber. And in A fiber there are A alpha, beta, delta and the gamma fiber. In that A delta fiber and C fiber of the free nerve ending are the nociceptors, and A delta fiber are the myelinated, so they have large diameter. So according to that classification, the nerve fiber which have large diameter have the fastest conduction velocity. So therefore, the nerve ending which have A delta fiber have first pain, cause first pain or fast pain. That is, the pain is forwarded in fast time and this is slow time. Myelinated is a fast pain or first pain. C fiber unmyelinated, slow or second pain. Nociceptors are present in all body tissue except brain tissue. You have to remember. That is brain tissue, which interprets the different stimulus and different factors. That you don't have nociceptors, but the brain meninges are rich of nociceptors. There are two types of nociceptors. Since there are two types of fiber, so therefore there are two types of nociceptor. E delta, mechanical nociceptor, polymodal C fiber nociceptor. A delta mechanical nociceptors. Since A delta free nerve ending act as a nociceptor, free nerve ending of the A delta fibers. A delta fiber has a large diameter because they are myelinated, so the conduction velocity is fast, therefore it causes fast pain, first pain. Since it is only receives stimulus of the mechanical nociceptive stimulus, so mechanical nociceptor, not for the thermal and the chemical nociceptive stimulus. It is called the polymodal because C fiber receive nociceptive stimulus from all thermal, mechanical, chemical, but more specific to thermal and chemical only. Free nerve ending of the C fiber, slow pain or the second pain. An important point to note here is that thermoreceptor and thermonociceptor both are different. Thermoreceptor sense temperature change. Thermoreceptor sense temperature change, but that temperature change which cause pain. For example, the normal temperature does not cause pain, but fluctuation in that temperature will give you the sensation of the temperature change. But the temperature which is below 5 degrees centigrade or above 45 degrees centigrade will cause pain. After that, what are the types of pain? There are the fast pain, slow pain. Fast pain, slow pain. Fast pain have the large conduction velocity, therefore they will reach the sensory cortex area in 0.1 second. They will reach in 1 second. First pain, because it appears first, it appears second. This is second pain. The sharp pain, localized pain. A delta fiber will conduct fast pain, myelinated. C fiber will conduct unmyelinated. A delta fiber is a part of the neospinothalamic tract. We will learn in the how the pain travel to the neospinothalamic and the paleo-spinothalamic tract. Slow pain by the paleo-spinothalamic tract. Fast pain, fast conduction velocity. That is acute pain, short-lasting, slow conduction velocity. Chronic pain and the long-lasting pain. Other further types of pain are the superficial pain, which from the superficial structure like skin, subcutaneous tissue. The superficial pain are usually the fast pain. A deep pain from the deep structure like muscles, bone, connective tissue, etc., viscera. Usually they are the slow pain. Other is the somatic pain and the visceral pain. The pain which arises from the somatic structure are the somatic pain. The pain which arises from the visceral structure are the visceral pain. Other classification are the physiological pain or pathological pain. Physiological pain are the good pain because whenever the physiological defect that will cause pain, and whenever there is a pain, physiological pain is the earliest indicator for the morbidity. So we can treat accordingly. Acute pain, good pain. Pathological pain are the chronic pain and the bad pain. Further, the pain pathway we will continue in the next lecture. Thank you.